Welcome to Let the Quran Speak. We recently posted a video debunking misconceptions about COVID vaccines. Some of you remained skeptical and unconvinced. So this is for you. We've got a doctor here to address your concerns. Joining us is Dr. Kashif Pirzada, an emergency physician in the Toronto area. Dr. Pirzada, welcome to Let the Quran Speak. I'm so happy to have you here.
Thank you, Sister Sophia, for inviting me to your program and allowing me to speak to your audience.
I want to jump right into some of the concerns people raised about the vaccines. Here's the first one. The vaccines were rushed out. We can't know if they're safe. Were the vaccines hastily made, Dr. Pirzada?
That's a good point. It is true that they were made very quickly, but this is an example of what happens when all of humanity's efforts are concentrated on one goal. I can think of a few examples previously, like World War II, for instance, or the moon landings. And I think this is something we should be doing more often, to solve things like climate change or poverty. It also builds on decades of research on mRNA vaccines. I did lab research, when I was a student 20 years ago, and this kind of stuff was science fiction at that point, and to see it real is amazing. The other thing is that the Ebola vaccine was developed as an mRNA vaccine here in Canada, and it's been used on thousands of people since 2016 with no long-term side effects.
Thank you for that. Here's another comment. Has the vaccine been tested enough? What confidence can you give us that the vaccine is safe for our use?
Good question. The vaccines went through what's called randomized controlled trials. All of the main candidates, including Pfizer, Moderna, Johnson & Johnson, and Oxford, were tested on tens of thousands of people. This is where you take a group of 20, 30,000 on one end, 20, 30,000 on the other end, and then give them one group placebo, one group the vaccine, and then see the rates of how many people got COVID in each one. And the trial results were fairly impressive, much better than people were expecting, where the mRNA vaccine showed that they prevented 95% of illness. And in those people who did even get COVID-19, they got severe illness at a tenth of the rate of people who didn't have the vaccine. So that's very impressive.
Some people have said there are severe side effects, including Bell's palsy and allergic reactions. Is this true, Dr. Pirzada?
Yes, there are some concerns about side effects. There were reports of Bell's palsy with both of the mRNA vaccines, but if you look carefully at the rate in which they got them, I think there was something like 7 or 8 cases in about 90,000 people. That's actually less than the population rate. So if I took 90,000 people in the population, they would have many more cases of Bell's palsy. So it's actually less than what we would see in the general population. What we've also seen, though, is that people who are prone to severe allergic reactions, like if you carry EpiPens, let's say you have a reaction to bee stings, those people, some of them seem to be developing severe allergic reactions to the vaccine. And I think those group of people are being told to hold off on getting the vaccines at this point until there's more information available.
Has anyone died after taking the vaccine?
No, absolutely not. There are no reported deaths from the vaccine. Some people have developed COVID after the first shot, because full immunity doesn't really take effect until about 2 weeks after the second dose. So even when we all get vaccinated after both doses, and remember, for the Pfizer, it's you get one dose and then wait 3 weeks to get a second dose. And with Moderna, it's one dose and then 4 weeks to get the next dose. Even after we all get vaccinated, we're still going to have to be careful with distancing and masking, even for a few weeks after that. So we're going to have to be careful for some time.
The vaccine will change your DNA. What do you have to say about that, Dr. Pirzada?
No, absolutely not. It can't change your DNA. mRNA is kind of a temporary messenger in your body. It's broken down very quickly. This is why they've had to be kept in these crazy -80, -20 freezers. And it's kind of like, imagine if you had a sticky note, let's say, a sticky note.
Okay.
That's what they're like. This is something you use and you throw it away, versus, say, a full textbook or something like that. You can put sticky notes in a textbook, but eventually they fall out and get thrown away. So think of it in the same way. The sticky note gets thrown away, but the book stays the same. mRNA is used up, turned into a protein. Your immune system reacts to that protein. You get immune to the virus. But the DNA, the textbook, stays the same.
The vaccine contains mercury, aluminum, and other harmful substances. Can you respond to this claim, Dr. Pirzada?
I think the vaccine were made by different companies, were made deliberately to not have as many of the preservatives that we've seen. with previous vaccines. They do contain polyethylene glycol, which is used in the mRNA vaccines. But this is, a common laxative. We give this to children all the time, and they don't have any ill effects from that. And we use it on babies, like right down to a few months old. So this is not a dangerous thing, and it's a common thing. But if you have allergics to polyethylene glycol, then you shouldn't take the vaccine until there's more information.
The vaccine contains pork gelatin or fetal tissue. Have any of the COVID vaccines been made using these substances?
No, absolutely not. I don't think there's any underlying pork products or fetal tissue used in the manufacturing of the mRNA. It's possible that some of the underlying research decades ago used cell lines derived from fetal cells, but that would have been, in the 80s, 70s, or 80s. It would be the equivalent of, let's say, taking my grandfather, if he stole a loaf of bread in the 19th century, and then me being accused of the crime and punished for it now. It's completely unrelated to the manufacture of this vaccine.
Here's an alarming claim. The vaccine makes you infertile. Is it true, doctor?
No, there's absolutely no evidence that the vaccines make you infertile. And previous mRNA vaccines like the Ebola one hasn't done that either. So there's no evidence for that whatsoever.
Thanks for clarifying that. Here's another comment from a viewer. There is zero liability in the courts for vaccine damages, so no one will take responsibility for its harm.
So the liability question is quite interesting. There's always been a limited liability for vaccine manufacturers in the Western world, and I'll tell you why. So taking a vaccine like measles, mumps, rubella, the MMR vaccine. Every kid gets this when they're 12 months and when they're 4 years old. Maybe some of your viewers will be old enough to remember what measles was like, but if I've worked in refugee camps, and measles is the primary killer of children in these camps. We might have forgotten what it's like, but those people will not. And if you go look at any field manual by a group like Doctors Without Borders, the first step when you secure shelter, clean water, is measles vaccination of the population. Now, the problem is about 1 in a million people who get the measles vaccination will get a very bad reaction. And so what the governments did is they've set up limited liability for the companies making them so that they don't get sued out of existence when those bad reactions happen. What happens is that governments set aside a fund for people who are harmed to draw from and get compensated for what happens. So 1 out of a million, unfortunately, will have a bad reaction, but hundreds of thousands of children will live as a result of that. So it's a trade-off that is being made. And it's one of the reasons, in the lawsuit-happy American court system, is one of the reasons why there's so few vaccine manufacturers in the US until recently, was because they had troubles getting legal liability, limited liability for this. And one of the reasons, if you look back in 2009, in the last pandemic, the H1N1 flu pandemic, the Americans were actually trying to steal doses earmarked for Canada that were manufactured here because they didn't have enough manufacturing of their own. So there is limited liability, and there's very good reason for that, because by a scale of 1,000,000 to 1, the benefits far outweigh the drawbacks.
There are new strains of COVID. The vaccines available now won't be able to protect against them. What are your thoughts on this statement, doctor?
Yes, there are strains of COVID-19. There's, the one everyone knows about in the UK. There's one in South Africa. There's been tests based on the antibody treatments that we've made so far, like the Regeneron or the Lilly one, and other tests that show that these vaccines should still be active. There are some mutations, but not enough to make them ineffective. It could be that over time, maybe next year or the year after, the current crop of vaccines will not work against COVID-19, but then we'll have time to capture them and then to really study and then prepare booster shots. So this might be something that we would need yearly booster shots for in the future.
Dr. Pirzada, how would you respond to people who say that COVID-19 is a myth?
Honestly, I don't have much to say to these people. I know that I won't be able to convince them, and no one really will. And I don't think you should even try to convince them, because they're too far gone. I would say, come visit my hospital and come see our full ICU and look at all the relatives lined up outside who can't go inside and say goodbye to their parents or relatives. They have to do it through iPads or FaceTime or WhatsApp. Maybe go visit the old Italian or Somali grandmothers who are struggling to breathe, who are terrified, with no one around them to comfort them in their final days, completely confused, having no idea what's happening to them. Why don't you go visit them and then come talk to me after that?
Thank you for that, doctor. Where can people go to find trusted information about the vaccine?
I would follow reputable reputable media, like national media outlets in your country. In Canada, that would be CBC. In the UK, BBC. Reputable newspapers that are published, that are actually real newspapers, and trusted authorities also in your country, such as, your national public health leaders. I would generally avoid getting any information from social media unless it's from a trusted source. What we've seen is that a lot of misinformation is being spread through things like WhatsApp forwards, YouTube videos, an unfortunate weakness in a part of the population to think that if it's online that it's true. It definitely isn't. You have to check the authority, and generally widely published things on existing media like television and newspaper print media are more reliable than social media. And the other thing is, I would consult with your own physicians and your experts to clear any question that you might have.
Given all that you've said already, I'm assuming that you think everyone should get the vaccine?
Oh my gosh, absolutely. Just to show you, my colleagues in my emergency department have been clamoring to get the vaccine. Like, we couldn't get it fast enough. Each of us has, over a decade of post-secondary education. We've read all the studies. We've read the fine print. We know exactly what we're signing up for. And honestly, like, if I had to take the injection in my eye, I would if I had to get it. So that's how desperate we were. I just got mine yesterday. So I lined up, I waited, and I got it. And I have no doubt about it. That was the right thing to do. I did not have any side effects. I felt maybe some chills in the evening after. It went away quickly. And I feel fine a day after. So I think when your chance comes, you should definitely get it.
Thank you for joining us, Dr. Pirzada, and for taking the time to respond to these concerns. And thank you for being in the trenches, helping to save lives and keep people safe. Thank you.
Thank you so much for your kind words and allowing me to speak to your audience tonight. I hope all of you stay safe. Take care of each other. Keep your family members safe, especially the ones at risk. We don't have far to go in this. We're at the finish line, but imagine there's a big quicksand trap in front of the finish line. So we got to all collectively jump over that and get to the finish line. It's just a few months away. Hold fast and hold on. That's all I can say, and stay safe.
If you enjoyed this video, click like and subscribe, and please donate to support our work at QuranSpeaks.com.